Good evening. My name is Francisco Gallo. Today we're going to do a presentation on back pain, prevention and reduction of back pain. Our intended audience is nurses and CNAs. Nurses includes LPNs and RNs, specifically at Graham Hospital in Canton, Illinois. Um, and this is because of the incidents that we have noticed for back pain. That is one of the reasons it's high incidence, and also because we want to help prevent it, because this back pain creates a bad environment for nurses. When they're in pain, they are not as able to care for their patients, and well, the relationship with coworkers and themselves can improve if they're not in pain. So we're going to be teaching exercises. We're going to be talking also about body mechanics. Lori Hazlett is going to talk about exercises, and this is more related to both prevention and reduction. And Sarah Williams is going to talk about prevention, body mechanics specifically. And in my case, I'm going to talk about the activities related to back pain. And again, our objective is for nurses and CNAs to learn at least three of these exercises, biomechanics, and activities related risk factors related to back pain for nurses and CNAs. And well, we can start. So, part of the activities that are related to back pain is lifting. We handle patients and also equipment, and we sit down for long hours. So basically, we're going to focus a little more on handling patients, because that is one of the things that we face the most, and one of the things that create, or risk factors that creates more back pain in healthcare workers. If we apply body mechanics, then we can prevent it or reduce it by knowing about these activities, which are the ones that I'm going to mention, that we know them, but we also need constant reminders of this. So some of the activities is when we rotate patients, basically when we transfer patients, when we turn patients. Um, so working with patients, transferring, bathing patients, even ambulating patients can be if they fall. So we know that we're facing a situation. I mean, knowing about this is we know that we're facing a situation that can put us at risk for back pain. Um, so even making beds. The idea is to apply what we're going to talk about and, well, prevent it or reduce it. So again, transferring patients. If I know that I'm going to transfer a patient or turn a patient, I have to assess not only the patient. If it's an obese patient, a mobile patient, then I have to stop myself and say, can I handle it? Am I applying the right body mechanics? And if not, if the answer is no, then don't do it, because you're going to hurt your back, and that can have consequences. You can miss work. So stop yourself and either get help or tell the patient something. We're going to wait a little until we get help, or and but the main idea is for us to know and be able to stop ourselves and prevent it. So now we're gonna leave you with Sarah Williams. She's gonna talk about body mechanics and, well, how to prevent pain that way.
About body mechanics, I want to show you how to properly um, stand up a patient without bending your back, and this will help with the strain of your back, and you're using your leg muscles versus your back muscles. Another is transferring a patient from the bed to the wheelchair and how to properly position your legs when transferring. And another is how to get close enough to the patient when they're in bed to turn them properly without bending at the waist and putting more strain on your back. So the first one, I'm going to have Javier lay in. No, I'm gonna have him And in bed, we're already going to have him turned. And
You want him in the chair or you?
we'll do the transferring
Okay.
with the bending of the knees. And this will also go with the back, but I will show you how to do that in a minute. But you always want a patient safety with the gait belt. And like Javier said, if you are not able to lift a patient safely, this is all backwards. If you're not able to position the patient safely with just one person and a gait belt, then you will have to have extra assistance. Oh, it's all turned, but I'm gonna tighten it. It's not going to be too tight, and you're going to position your legs, one leg in between, and you preferably want it your dominant leg, but depending on the situation and the layout of the room, and between his legs and one on the outside. And then I'm going to bend at my knees, and I'm going to give him a 1, 2, 3 count so he can stand with me. So 1, 2, 3. I'm going to lift up with my legs and my arms, not my back. Then I'm going to turn and put him in a chair without twisting my waist. And this helps with the strain of your lower back. You don't want to be using these muscles. Then I'm going to focus on just bending my knees, and we're just going to go straight up. So I'm going to have my knees bent, my back straight, and I'm going to do the 1, 2, 3 count. 1, 2, 3, and he's going to stand up. And I'm lifting him with only my legs and my arms. Another way to prevent back injury is if you're ambulating a patient and they are about ready to fall, instead of accidentally catching them and bending your back, you have it positioned where they slide down your leg. This will prevent back injury on yourself. You lower them all the way to the floor, and it will help prevent injury with your patient. So patient safety. Then the next one is the patient will be in bed on the far side of the bed, and I need to get them on this side. So what I would have them do, first I'd raise the bed up to the waist level, so it would not be this low to begin with. But I would have my non-dominant leg on this, and he would not be this close, but I would grab the sheet to turn him my way, still leaving my leg here and my foot planted and safe. And then I do 1, 2, 3. I'd roll him this way, and then this is only in my arms. And if the bed was up, I'd only be using my leg muscles as I stood up with him in my arms. But lower the couch, it kind of prevents me from doing that. These 3 exercises will reduce or prevent the back pain injuries, and it will use proper body mechanics. Another couple things is good posture when you're sitting, standing, walking. Practicing good posture will help with the strain of your back and will reduce the incidence of back pain injuries. And now Lori will come and do her exercise bit.
So hi, I'm Lori. I'm going to teach you guys a couple of exercises, not only to help prevent injury to your back, but also strengthen those back muscles, stretch them out, and keep them in good condition. Now, before you start with any of these exercises, you should probably consult with your physician in case you have any health conditions that might interfere with these exercises that I'm going to do. So the first one I'm going to teach you is about elongating your spine, and this is actually a little Pilates exercise. So Sarah's going to be my guinea pig today. And what this does, most of these exercises help strengthen your core muscles. Now, these core muscles are very important to help keep your posture straight and keep those back muscles in good condition. So what she's going to do is she's going to stand about a foot away from a wall, and she's going to lean against the wall. She's going to press her shoulders into the wall and gently have her head rested against the wall. Now what she's going to do is she's going to inhale very deeply for me, And when she exhales, she's going to engage those core muscles and try to push that lower back into the door. And this kind of helps elongate the spine. And what she can also do is kind of imagine that she's pulling a string between the base of her spine and the crown of her head. And this helps strengthen that spine up. Can you feel it? Good, good. The other thing we can do is called a wall crunch. So what she's going to do, again, she's going to stand about a foot away from the door. She's going to lean against it. She's going to press that lower back into the door, and she's going to, again, engage those abdominal muscles, keep them nice and strong. So she's going to lower her legs. Ideally, this is supposed to be at a 90-degree angle. I'm not going to make her do this anymore because this does take a little while to get the hang of. But ideally, she should do this 10 times, hold it for 10 seconds, and she should do that for 10 reps. And what that's going to do is that's going to help keep those abdominal muscles strong, assist with posture, condition those back muscles. And it's also going to help strengthen those leg muscles because there's a lot of tension in those thighs when you're in that position. So the other exercise that she can do is something called transverse abdominal marches. So what she's going to do is she's going to lay on the floor for me. And she's going to flex her knees. Again, she's going to keep those stomach muscles nice and crunched for me. And she's going to lift one leg, pressing her lower back into the floor, and let it down. And she's going to do it on the opposite side too. She's going to keep those stomach muscles tight. I felt something pop. That's good. And then lower that leg down. And she's going to do that. She's going to do 10 reps of those. And she should ideally do those twice a day. You want some help up?
Oh, yes, please.
Again, when you're helping your patient up off the floor, keep your back straight. Another thing that you can do is one of the most easier things that you can do to keep those back muscles nice and strong is simply walking, because those help build up those gluteal muscles, and those lower back muscles help keep everything nice and strong, keep that posture nice and straight.
The other things that we couldn't have mentioned in our video would be we would have handouts, like packets. If some staff member is too tired, just got off third shift, and they didn't really want to participate, but they're still interested in our exercises, we can give them informational packets on how to do these exercises and read about the importance of them. And then we also made up flyers that would go on any bulletin board, so they're easily accessible to for a reminder when you're walking down the hallway, to remind yourself, hey, when I'm turning this patient, this is what I need to do. Oh, my back hurts. I can just do a little couple stretches. It's awareness and knowledge about how to prevent and reduce back pain. And overall, it will improve the quality care of our patients.
Okay, well, that is our presentation of back pain. We thank everybody involved in this. And of course, the main idea for this is to show our appreciation for nurses, and as nurses, taking care of nurses. So one of the things that we think it's very important is to create a conversation with nurses, because at the end of the day, we're a team and we can do it together. So, and consider other things, because we can do the exercises together. Our goal is for you to remember at least 3. Simple. Of course, we know that there's a lot more that you can practice with your coworkers. But there's a lot more things that you can do also. For example, diet, nutrition, taking, deep breaths, and well, that is prevention and reduction. Of course, doctor's appointments, taking care of yourself, and that is the main goal of this. So we can take care of our patients and we can take care of our community, because that impacts your day, and if you miss work, you can't take care of them. So that is the whole goal. It is important to keep it in mind. And as Sarah said, for you to keep it in mind, we are going to post these all around the hospital. You can take one and to your buddies and, well, start exercising and preventing back pain. Thank you.